This is originally the JKMD paper, 2013 JKMD. The Jammu Kashmir paper, like UPSC paper, is a very well framed state MD entrance papers. So doctor, cornea is lined by. So this is a very well placed question. It is the stratified squamous non-keratinized epithelium is the one which supplies the cornea. Few tissues are stratified squamous keratinized and few are non-keratinized, as all of you know very well. Where is the upper border of the sternum is another important question. So you need to remember that it is the lower border of the second thoracic vertebra is the point at which we find the upper border of the sternum is what you need to remember. So what is sphenopalatine ganglion? Sphenopalatine ganglion is an example of a classical parasympathetic ganglion, as all of you know very well. Left ovarian vein drains into the inferior vena cava, right ovarian vein drains into the left ovarian vein, left ovarian vein joins the left renal vein instead of inferior vena cava. So the correct answer should be B, not A is what you need to remember. Kellett's triangle. There is a small correction about the earlier question. Answer should be into the left renal vein instead of into inferior vena cava. Kellogg's triangle. What are the boundaries? Typically, it is also called hepatobiliary triangle. Common hepatic duct medially, cystic duct laterally, inferior margin of the liver superiorly is the typical boundaries of the hepatobiliary triangle. So it is not the hepatic artery, but common hepatic duct, cystic duct and inferior margin of the liver are the ones which typically constitute the boundaries is what need to be remembered. Now doctor, cyclic-CAMP as a second messenger. I am very happy to see our Tirupati students also getting online. So in full effacement you need to take with confidence the state MD entrance on Sunday, forthcoming Sunday, and on Monday evening 5 to 8 p.m. we will have a discussion on the real APPG exam. So we need to remember secretin, calcitonin, ACTH. They all use the cyclic-CAMP. Whereas if you take the oxytocin, it doesn't use the cyclic-CAMP, rather it uses the phosphoinositol system is what you need to basically remember. Now if you look at the reabsorption of the bicarbonate in the kidney, what is the general rule that you need to remember? Typically in a potassium loaded situation, bicarbonate reabsorption is depressed, and in a potassium depleted individual, bicarbonate reabsorption is increased is what I want to underscore to all of you. Can the online students can punch whether the voice is loud and clear, doctor, for you to perceive is the volume low volume or is it loud and clear? Please punch into the, yeah, thank you Balina, that the voice is loud and clear. Okay. So hypoxia, what are the important effects of hypoxia? Mainly hypoxia stimulates peripheral receptors, peripheral chemoreceptors, but not the central chemoreceptors is what you have to basically remember, which is one of the favorite questions of the examiner. Very good. We have Ritu, Krishnamani, many more online. That's good. So doctor, acute hypoxia, it stimulates peripheral chemoreceptors which in turn lead to sympathetic activation which will lead to the rise of the blood pressure. Some of these questions, once more, if they come straight in the state MD entrance, there is no surprise. Now, doctor, blood pressure increases, heart rate decreases. Typical Cushing's reflex. Whenever there is any raised intracranial pressure is what need to be remembered. Connexon is an important component of the gap junction, as all of you know very well. Now, alpha helix, B-pliated sheet, they are the classical example of secondary structures, is what you need to remember. For the citric acid cycle, you don't need retinoic acid, but you require pantothenic acid because coenzyme A contains pantothenic acid. Niacin is a component of the NADH, and vitamin B1 is very important component, thiamine, for the pyruvate dehydrogenase complex. What regulates our blood pressure? Everything about the differences of glucokinase and hexokinase. You should be 100% sure, doctor. So, if you look at the Km value of the hexokinase, it is significantly lower than glucokinase. So, this difference is very, very important, so that the liver will sense whenever there is a low glucose state to release the glucose, whenever there is a high glucose state to convert that into the glycogen. So that is the reason it is the glucokinase which is there in the liver. Hepatic glucokinase is the one which is the main regulator which will decide whether it is the time to release the glucose or to store the glucose, is what you need to remember. So where is lipoprotein lipase located, doctor? It is the walls of the blood capillaries, which is the classical location in the vascular endothelium, and it is activated by the apoprotein C2. Once more, apoproteins is one of the favorite topic of the examiner. So what are the ribozymes? RNA molecules with catalytic activity. This is a very important question, microbiology, doctor. Oxidase negative, oxidase positive. Typically, protease is oxidase negative and catalase and nitrate positive, is what you have to ultimately remember. Neisseria are oxidase positive. Campylobacter, Vibrio cholerae, Helicobacter, oxidase positive, is what you need to ultimately remember. So what is the function of interleukin 2? Interleukins is another very high yield topic. Whether it is Jammu Kashmir MD entrance or APPG or a Kanyakumari entrance, ultimately interleukins is, these are all the high yield topics for that matter. So B cell differentiation, you require the interleukin 2. Chlamydia is responsible for the non-gonococcal urethritis. Out of all this, what is most potent exotoxin? Actually, both tetanus and botulinum toxin, both of them are potent. But Clostridium, actual correct answer should be botulinum, not tetany, but Clostridium botulinum. Correct answer should be B. One more correction in the key. Sorry to release the key little late, because this is the last exam. We are last mock test for this season. Once more, from Sunday we have a new series of All India MD entrance mock test that will be starting along with the state MD entrance and DNB pattern mock tests, and also discussion. So doctor, it is the botulinum, there is a correction in this, which is considered to be the most potent toxin which is known. Now, herpes virus is known to lead to latent infection. Then the next important question is, what is the most common opportunistic infection of HIV in India? In India, it is the tuberculosis. हम इस देश के वासी हैं जिस देश में टीबी बहती है. So you need to remember zero order kinetics versus first order kinetics. If 100 become 50, 50 become 25, 25 become 12.5. with every half-life, then what do you call it as, doctor? First order kinetics, where logarithmically there is a fall. Whereas if 100 become 95, 95 become 90, 90 become 85, fixed amount is getting eliminated rather than fixed proportion, you call it as zero order. Zero order is a slow method of drug elimination. So what we need to remember is a constant amount instead of a constant proportion. If it is being eliminated, then you call it as zero order kinetics is what you need to basically remember. So doctor, this is one favorite illustration of examiner which you need to know. What's happening here? With every half-life in the first order kinetics, how is the half-life? Is it changed? No. But if you take the half-life in zero order kinetics, it will be varying. So that is the main difference between zero order versus first order. The amount of drug which is being eliminated is, for every half-life, is constant. But the half-life is not constant. That is, the time taken for 100 to become 50 is not same as 50 to 25. Typically, in zero order kinetics, that is the main difference. Anyway, we discuss all these things in a great detail in the pharmacology session. So we welcome our the new students who joined for the next season, who are participating every day evening 5 to 8 p.m. whether it is Shivaratri or Independence Day, Republic Day, any day we have a session 5 to 8 p.m. because preparing every day is one of the important parameters that characterizes a willfully determined student, which is the important trait for winning the entrance exam. Now doctor, now let's talk about the next question, which is not bound to the plasma proteins. Beautiful question. What is the Murphy's law which I told you? If you don't know what is the answer, if lithium is there in the options, that becomes the answer. Take it as my thumb rule. So phenylbutazone is highly bound, but lithium is excreted mainly in the urine and it is not bound to plasma proteins, is what need to be remembered. Now, if you take the enterohepatic recycling, all these drugs will undergo, but comparatively penicillin doesn't undergo, but ampicillin undergoes the enterohepatic recycling, is what you have to fundamentally appreciate. Now, which drug is excreted mainly unchanged is a very important question. Streptomycin, don't forget, digoxin, streptomycin, amphetamine, ampicillin, penicillin, tetracycline, mostly unchanged. Phenacetin, morphine, chloramphenicol, isoniazid, they become changed and their metabolites are the ones which are basically excreted, is you need to basically remember. Now coming to the renal impairment, doxycycline, you can give it without altering the dosage even in a patient who has got renal failure. Rule number 2, ceftriaxone, cefaclor, cefperazone are the 3 important cephalosporins which can be given without changing the dose in a patient who is having the renal failure, is what need to be remembered. You know very well that warfarin crosses the placental barrier, but heparin does not cross the placental barrier, is a very, very important point that you need to basically remember. Now doctor, Samoma body, what is an example of? There are 2 types of calcification. When calcium levels are high, even in normal tissues it will go and deposit, and that is called metastatic calcification. Though the calcium level is normal, if there is a degenerated tissue, into that calcium will go and deposit, that's called dystrophic calcification. Some of my bodies are example of dystrophic calcification is what you have to ultimately remember, doctor. As I told you, definitely one question comes on CD markers. Any entrance exam you go. So what do you need to remember, doctor? CD15, CD30. Typically, we see it in the classical Hodgkin's lymphoma. What is meant by classical Hodgkin's? Nodular sclerosis, mixed cellularity, lymphocyte rich, lymphocyte depleted. These first 4 varieties are called classical. Whereas lymphocyte predominance type is there, no? That is not classical. And what is the main difference between the two? Classical Hodgkin's lymphoma may CD15, CD30 will be positive, but it will be negative for CD45. Lymphocyte predominant Hodgkin's lymphoma may CD20 will be positive, but CD15 and CD30 will be negative, more like B cells. There is a fundamental difference between classical and lymphocyte predominant lymphoma is what you have to emphatically remember. Straight question can come in the tomorrow's DNB in August, or it can come in All India in December. So with the advent of DNB exam, there is no reason to disappoint for any student. If he is not fully prepared by the time it is Jan-Feb, the DNB will be fast approaching in August, AIMS will be there in May, once more All India will come in November. So like that, there is no time to regret, repent and retrospect. Only we need to go with a forward outlook. Now doctor, what is the largest cell in the myeloid series is an important question. It is the promyelocyte. Promyelocyte is the one which is considered to be the largest cell in the myeloid series. When will hemoglobin start appearing, doctor? In the erythropoiesis is a very, very interesting question. So what are the various steps which are involved in the erythropoiesis, doctor? Hemocytoblast, proerythroblast, early normoblast, intermediate normoblast, late normoblast, reticulocyte and erythrocyte. Out of this, it is the intermediate normoblast where the hemoglobin starts appearing is what you have to ultimately remember. What is the special nature of the vegetations in rheumatic heart disease? Typically they are small warty vegetations along the lines of closure of the valvular leaflet is a typical description of the vegetation of the rheumatic heart disease. As what you can see here, the valve involvement with fibrinoid necrosis and the fibrin deposition is what need to be remembered. One question definitely comes on apoptosis. Once more on Monday evening 5 to 8 p.m. we will have the state MD entrance paper discussion. I can guarantee you that there will be a question on apoptosis. So apoptosis, what is the hallmark, doctor? Cell shrinkage is the hallmark of the apoptosis. So what is Bansedola? Bansedola is a method of a homicidal strangulation. What is the difference between strangulation and that of the hanging? Without the suspension of the body, if at all there is any violent asphyxial death, then we call it as strangulation. Bansedola is a classical example. Now, constricted pupils which become dilated on pinching the skin. Classically, where do you see, doctor? McEwen sign, it is called as. Alcohol poisoning is a classical example where we find McEwen sign. So what is Sin of Gomorrah? Sin of Gomorrah is about the oral coitus, buccal coitus, where the male genital organs is being taken into the mouth by either a male or a female sex partner, is called as the Sin of Gomorrah. This is a very interesting question, doctor, about the firearm entry and exit wounds. All these are the false statements. You need to remember this very, very important table. The outer table has a sharp margin, inner table has a beveled surface. That is the nature of the entry wound, where you have a punched in hole. The exit wound will have a punched out table, where the outer table has beveling, inner table will have the sharp margin. So that is the reason clean hole in the inner table of entry wound is wrong. Typically in inner table you don't have clean, but you have a beveled surface. Beveled opening in the outer table of the entry wound is wrong. In the outer table of the entry wound you have a sharp margin, not beveled. Beveled opening in the inner table of the exit wound is wrong statement, because in the exit wound, on the inner table you have a sharp margin, and there is a clean hole in the inner table of exit wound and a clean hole in the outer table of the entry wound. So that's the reason all the four statements are wrong. One of the excellent questions framed in the JKMD paper, which can be a repeat, which is possible in the forthcoming entrance exam. Under NDPS Act, what is included, doctor? Amphetamine, hashish, opium, all of them under the Narcotics Act, Narcotic Drugs and Psychotropic Substances Act. NRHM, National Rural Health Mission, is typically introduced in 2005, April. This is a beautiful question about the rabies. If already person has received a pre-exposure prophylaxis and then had been bitten by the dog, then how many doses are required? Only 2 doses. No need of passive immunization with immunoglobulin. Only 2 doses with IM or ID, intramuscular or intradermal injection is only that is required. Only 2 booster doses. If he already took a pre-exposure prophylaxis, like a veterinarian or the one working in the zoo, like that. You can't assess qualitative data using histogram. Histogram is for quantitative data. Bar chart is basically for the qualitative data, is what you need to be doubly sure about it, doctor. Biochemical oxygen demand of the sewage. Very interesting question. It is the amount of the oxygen which is required to oxidize the organic matter is called as oxygen demand. Once more the question can come. How do you call it as strong, not strong, etc.? So basically, doctor, if at all, if you take the average sewage, if it is 200 milligram per liter or less of BOD, then you call it as weak sewage. With 500 or 1000 you call strong, etc., etc. So I leave the literature for you to review. So we generally go for a pollution check. What we are checking, there is a carbon monoxide and hydrocarbons are the ones which are checked. So what is not a contraindication for the OCP, doctor? Anemia is not a contraindication for OCP. It is not a contraindication for OCP. Now all functions of Anganwadi worker, doctor, once more same question is going to come in the tomorrow's exam. Basically Anganwadi worker does not do any immunization. There is a difference between Anganwadi worker, birth attendant, versus A&M versus staff nurse, etc. So, supplementary nutrition, non-formal education, health education, they are all the ones which are basically taken care by the Anganwadi worker is what you have to ultimately remember. Fortification of the foods is a classical example of a primary prevention with specific nutrients like folate, etc., etc. Then what is that committee which said child labor should be abolished? It is the Gurupada Swami is the one, committee is the one which is important for the addressing the problems of the child labor in India is what need to be remembered. So what is Balahar? Balahar basically contains whole wheat flour and groundnut flour is the one which is the important component of the Balahar. Then which vaccines can be frozen, which should not be frozen? You must be very clear on that list, doctor. Vaccine which is damaged by freezing include DPT, DT, TT and hepatitis B. Vaccines that can be frozen without harm include BCG, OPV and measles before reconstituting it is considered to be a very, very important principle. Now, how long multi-drug resistant TB continuation phase is? Basically, according to the older classification, multi-drug resistant TB means it is under the DOTS regime category 4. So, continuation phase is about 18 months and maximum duration of the intensive phase is around 9 months for multi-drug regime, multi-drug resistant TB is what need to be remembered. In varicella encephalitis, it is the cerebellum which is most commonly involved. Hyperventilation precipitates absent seizures, which is one of the favorite questions of the examiner. CMV lead to infectious mononucleosis like picture, just like the Epstein-Barr virus. What is meant by Bedford sign, doctor? Some of the common radiological signs you have to be very sure. So whenever there is any mitral stenosis with a left atrial enlargement will deviate the descending aorta towards left is basically called the Bedford sign is what need to be remembered. So I leave to you in the literature boot-shaped heart, convex left border, concave main pulmonary segment, inferior rib notching. Anyway, we will have a complete detailed review when we go take up the radiology session for those students who have joined for the next round of year-long daily evening review classes. So you are all welcome. We are also energized to see the newer and newer students. So doctor, soap bubble appearance, spider legging, cobra head, unless you see at least one radiograph and review, it is more easier to remember only when you review the radiographs. Okay, doc? So that is the Bedford sign. Broca's aphasia means dominant hemispheric involvement. That's the reason it is the left middle cerebral artery which is involved. Now doctor, fever of unknown origin, one of the favorite questions of the examiner. How do you want to define fever of unknown origin? Temperature more than 38.3 but not 39.3 is what you have to fundamentally remember. More than 3 weeks duration of illness. Older definition used to say inability to reach a diagnosis in spite of 1 week of inpatient, not impatient, inpatient investigation. But the newer definition says it even includes OP setting, 3 OP visits or 3 days in hospital without elucidation of the cause, or 1 week of intelligent and intensive invasive ambulatory investigation. That is a part of the new definition. So what is the answer, doctor, for this question? Fever more than 39.3 is not included. It is the 38.3 is what you need to ultimately remember. Lot of people who came to the conference got affected with pneumonia, where there is a fever, cough and vomiting, myalgia, diarrhea, constitutional symptoms. What is your diagnosis, doctor? On telephone your answer is Legionella pneumophila is what need to be remembered. So what is bagasosis, doctor? Moldy sugarcane, hypersensitivity pneumonitis basically. Out of all these, it is only the miltefosine which is considered to be the oral drug which is approved for the management of the visceral leishmaniasis is what need to be remembered. If the brain natriuretic peptide happen to increase, what does it mean? It means to say there is a congestive heart failure is what you have to ultimately remember. Syringomyelia with the central canal dilatation typically will lead to the development of central cord syndrome. 11-year-old boy comes to you, 3 Hz spike and wave abnormality on EEG. Classical description of absent seizures is what you need to remember. Acute onset of inability to close the left eye and deviation of mouth towards right side and loss of nasolabial fold. Classical of Bell's palsy. This is a beautiful question, doctor. Distal renal tubular acidosis. Let me tell you, renal tubular acidosis type 1, type 2. If you have not read, at least review the online video library. We have all the videos available. So one question definitely comes. Examiner want to be very particular whether you understood the concept or not. Because one topic called renal tubular acidosis, if you understood, means you know physiology, you know pathology, you know general medicine, you know acid-base disturbances. So many things are implied by one topic if a question comes on renal tubular acidosis. So doctor, in distal renal tubular acidosis, the tubule loses the ability to secrete the acid. Distal tubule is important for acid secretion, proximal tubule is important for bicarbonate reabsorption. So proximal renal tubular acidosis may, bicarbonate cannot be reabsorbed, bicarbonatenuria is there, because of which acidosis is there. Distal renal tubular acidosis may, H plus secretion ability is not there for the distal renal tubule. That is the reason H plus accumulates in the blood and that leads to development of acidosis. So in the distal renal tubular acidosis, since H plus cannot enter, doesn't enter, cannot be made to enter into the urine, what happens, doctor? Urine cannot be acidified. You can never bring down the urinary pH to less than 5.5. It always remains more than 5.5 because distal renal tubule is not secreting H plus. That is the classical feature. Otherwise, the osteomalacia, nephrolithiasis, normal anion gap, they're all the features of the distal RTA is what you have to ultimately remember. In pregnancy, we don't give acinetobutars which are strictly contraindicated. HDL is protective in nature. Osborne waves is what you see in hypothermia. Now, dengue fever may, what is the policy, doctor? The moment you suspect, take the serological sample. That is a very important principle. Take a serological sample. Ideally, 2 to 3 weeks later, convalescent sample you have to take. But generally, at the time of discharge, we take the second sample. Pulsus paradoxus is the fall of the pulse pressure to more than 10 millimeters of mercury is the important definition during inspiration. So where do you see reverse pulsus paradoxus? We have already discussed this in the recent mock test discussion. HOCM, hypertrophic obstructive cardiomyopathy may, we see reverse pulsus paradoxus. Why reverse pulsus paradoxus occur in HOCM? We will discuss it in our general medicine classes which are starting from March 10th. So please do come. Now doctor, 50-year-old methotrexate. Basically methotrexate Correct answer will be B, not C, printing error. So it is fundamentally antifolate, as all of you know very well. Phenylketonuria leads to high levels of phenylalanine in the blood because it can't be metabolized. Cholestatic jaundice is caused by OCP, steroids, sulfonylureas. All of them are known to lead to the development. Gold salts, nitrofurantoin, which is a sulfa product, and sulindac, chloropromazine, erythromycin, estrogen, they are all known to lead to cholestatic jaundice. A HIV positive individual typically presents PASP stain positivity. What else is required? The answer is pneumocystis carinii is what you need to fundamentally remember. Zollinger-Ellison is an example of hypergastrinemia is what you have to fundamentally remember. There are fasciculations, pooling of secretions, all excess acetylcholine cholinergic state. Where do you find, doctor? In case of the organophosphor poisoning is what need to be remembered. Pulmonary arterial hypertension, how do you treat? Favorite question in the exam, doctor. We use sildenafil, we use calcium channel blockers, we use bosentan like agents. So you must know what is the route of administration of these drugs, what is the mechanism of action of all these drugs, etc., etc. Scleroderma may, there is a renal crisis, doctor. Whenever there is a renal failure, no fool will give ACE inhibitor, at least will be afraid to give ACE inhibitor. But scleroderma renal crisis, we need to be foolish enough to give ACE inhibitor, which is considered to be the drug of choice for the management of the scleroderma renal crisis. Though there is a renal failure, we give the ACE inhibitors, is what you have to ultimately remember. A 45-year-old with a massive splenomegaly and myelocytes, metamyelocytes, classical example of CML, imatinib mesylate, has revolutionized the management of the CML, is what need to be remembered. As I told you, doctor, semen analysis of WHO is the favorite question examiner allowed to ask and know from you. So you should remember 1992, 99, 2010, periodically semen quality standards are varying across the planet Earth. WHO is also changing the standards. Volume is 1.5 ml is a good semen sample according to 2010. So more than 2 ml was required in 1999. Sperm concentration 15, total sperm concentration 39, total motility 40%, progressive motility 32, vitality 58, morphology 4%, leukocyte should be less than 1. Then you call ISI standard semen quality is what you will be able to basically conclude. These values you should remember. Straight same question can come in the forthcoming exam, so there is no wonder. Now you can use Levonorgestrel, IUD, Centchroman. All of these can be used in the postcoital contraception is what you have to basically remember. Anemia of chronic disease, ferritin level typically become elevated, unlike in iron deficiency where it is typically decreased. In orotic aciduria, orotic acid is an intermediate of the pyrimidine synthesis pathway. It plays a very important role for the conversion between dihydrofolate and tetrahydrofolate. If the tetrahydrofolate is not there, we develop megaloblastic anemia. So homocysteine metabolism and folate, importance of folate, they are all the favorite issues in biochemistry. We have already discussed it and put it in video library. Still once more, now you have an advantage. Every day there will be new classes for those who joined recently, with a live discussion to say that they are here live to prepare along with you. Same time you have archived video library of a complete content. There are the two important advantages. You have a huge video library, both theory wise, MCQ based, you can be able to review. In a 10-month-old child who requires CPR, what is the best technique? You should not forget, we use a technique called encircling two-thumb technique. Is the one which we basically use in order to do the basic life support. In Holt-Oram syndrome, what do you have, doctor? Absent radii, atrial septal defect, first degree heart block. The combination is what you see. Noonan syndrome may we find pulmonary valve dysplasia, whereas the Turner is associated with coactation, etc., is what need to be remembered. Infant of a diabetic mother, what is the important change? Is the volume okay? So we find a hypertrophic form of cardiomyopathy is what you need to ultimately remember. This is a beautiful question, doctor. A child can hop, it can use scissors, but it cannot skip on both the feet. Skipping on both the feet is one important feature which you get at 5th year, not 4th year. So that's the reason the baby is, the child is having 4 years of the age is a true statement is what need to be remembered. What is the best way that you want to avoid the sudden infant death syndrome? Never let the baby lie on the belly, prone position, don't let them. Supine position on a firm bed is the classical way you need to make a baby lie down when you are fathering, mothering, doctoring, anything with a child to avoid sudden infant death syndrome. Meningitis bullosa, erythema multiforme, they are all the things caused by the mycoplasma infection is what need to be remembered. In an adolescent, if there is a gynecomastia, there is nothing that you need to do heroically. You can wait and watch for a spontaneous recovery. Now, doctor, which is not a viral infection, herpes gestationalis, otherwise called gestational pemphigoid. It is a autoimmune blistering skin disease. It has nothing to do with any herpes infection. Whereas herpes zoster, herpes genitalis, herpangina, they are all considered to be the viral infections is what you need to remember. Multiple bullae, some are vesicles, some are pustules. What is the description? It is an impetigo. Impetigo classically is due to Staphylococcus aureus is what you need to ultimately remember. Eczema is of two kinds, exogenous and endogenous, so you must be sure. Contact dermatitis, napkin dermatitis, infective eczema, photosensitive eczema, they are all exogenous eczema. Endogenous eczema means coming internally, like atopic dermatitis, pompholyx, nummular eczema, pityriasis, etc. Psoriasis means there are nail changes, oil drop sign, etc. Who said absent nail changes? That's a wrong statement. 18-year-old male, there is a neck rigidity, petechial spots on the extremities, etc. is a classical example of meningococcal meningitis is what you have to basically remember. Petechial spots, etc. are the very important clue. So what is functional residual capacity, doctor? The volume of the air in the lungs with a normal expiration, not forced expiration. You call it as FRC, functional residual capacity is what need to be remembered. Nitrous oxide is stored like a liquid in the cylinders, true. It is a volatile agent and it has got the analgesic property. They are all the true statements. In the normal room temperature, what is the definition of a volatile anesthetic agent, doctor? It will be existing in a liquid form. normal room temperature. It can be stored in a liquid form, but ultimately it can be used to be inhaled and given as a inhalational anesthetic is what need to be remembered. Tracheostomy decreases the work of breathing is a true statement. Basically, cocaine is considered to be a CNS stimulant.